Hello, and welcome to your first lecture PowerPoint video. Your first PowerPoint video will cover stages of change, continuum of care, and NIDA treatment principles. Each of these modules are grounded in research, and they are used in the treatment of addictive disorders. In this module, we are going to review the stages of change, going through each of the different stages of change and talking about how these stages of change relate to the treatment of addictive disorders. I will also introduce the Continuum of Care and briefly touch on NIDA's Principles of Treatment. The NIDA principles were your assigned reading for this week, so we won't go too in-depth with them. Just make sure that you have an understanding of why it's important that you know of them. To start us off, we're going to talk about the Stages of Change model. The Stages of Change model was developed by researchers Prochaska and DiClemente in 1983. The model was first identified and developed during a study they were conducting on the cessation of smoking. This model describes the process and different stages that individuals go through on their way to change and originally had only 5 stages: pre-contemplation, contemplation, preparation, action, maintenance, and then it wasn't until later on that an unofficial stage was added to this model, which you'll see as being our 6th stage, relapse. The reason that the relapse stage was added is the recognition in the addiction and recovery field that relapse is a very normal part of the recovery journey that people go on, and that relapse is common. And so we wanted to make sure that in the Stages of Change model that relapse was identified as a natural part of these stages. Individuals who are seeking change may spend different amount of times in each of the different stages. It's possible that someone moves from pre-contemplation to contemplation and then back to pre-contemplation, so they can go forward and backwards. For professionals who work with individuals with an addictive disorder, this model can be extremely helpful in assessing where a client is in terms of their readiness or motivation for change. And with that knowledge, it will then help the professional determine the best way to engage that client in treatment. So let's get started talking about the individual stages of change. Our first stage of change is the pre-contemplation stage. Individuals in the pre-contemplation stage are not currently thinking about change. They do not see that their behaviors are problematic, and because of this, this stage is sometimes nicknamed the ignorance is bliss stage, where these individuals are in a high level of denial about the level of problem or severity that their addiction is causing them. Therapists will very rarely see this individual in treatment on their own accord, meaning that it's highly unlikely that this individual is coming in and saying, "I want help, I need the help." What's more likely to happen is that we see individuals in the pre-contemplation stage whenever they've been mandated by either courts or the other organizations. Also, we see this a lot with families where either a parent is saying, "You're going to treatment, I don't care what you think," or someone in a marriage, the partner is saying, "I want you to get help or I'm leaving." And that's when those individuals will end up in therapy. In a professional setting, individuals in the pre-contemplation stage are often viewed as being resistant to change, meaning the therapist is really highly likely to say, "This individual does not want our services right now, they're difficult to work with, they don't want to be here." They may be clients that can cause frustration if the professional is not understanding about why they're currently acting the way they are. And pre-contemplation helps us understand why there is that resistance, because to that individual, they don't yet see that there's a problem that they need any help with. Professionals who are working with individuals in the pre-contemplation stage should really put their energy into just validating how the client feels. It sounds like you don't see this to be a problem, although your spouse does. Or, "I hear that you're pretty frustrated that your mom is making you come into treatment even though you don't want to be here." Let these individuals know that it's their decision to seek change, and then help them encourage to evaluate their current behavior. So, "Okay, I hear that this is not a concern for you, but I wonder if we can spend a moment talking about why it is that your parent or your spouse may think therapy is appropriate for you right now." The next stage of change is contemplation. In the contemplation stage, the individual has moved away from being in denial, not viewing themselves as having a problem, to starting to recognize their behavior as being problematic. Here, the individual is starting to contemplate change, although they've not yet made any commitment to change yet. In terms of nicknames for this stage, we would see these individuals as being those sitting on the fence. Therapists or other professionals are likely to hear this client say, "I know I have a problem, but I do not know what I want to do about it, nor do I know how to even begin to change." It is helpful for professionals to work with them on evaluating the pros and cons of starting the change process. This will help them evaluate whether or not they really want to put the motivation in to begin to change. The third stage of change is preparation. In the third stage, this individual has had some experience now with change and are often seen as testing out the waters. In this stage, they will decide whether or not they are ready to fully commit themselves to the change process. Professionals can help this individual by helping them begin to problem solve. This might include thinking about what are the current barriers or obstacles standing in their way to starting the change process. Who are they going to rely on to be their support system whenever they decide to change? What skills do they already have that might be able to be utilized to help the change process? And then also helping them to just see what are those small initial steps that I can make now that they're going to have a high level of success. We don't want to make a huge goal for them that would cause them to fail and then lose motivation. We want to keep that motivation high. So helping encourage these really small, easily obtainable goals are really great steps for people to take during the preparation stage. The fourth stage of change is action. In the action stage, this individual is now practicing their new behaviors. This individual will be practicing abstinence from their addictive substance and should be in anywhere between 3 to 6 months of being abstinent from that substance or behavior of abuse. They are now practicing the things that they've started to learn in the preparation stage of change. Professionals can help this individual identify what new skills they've started to develop since they've been abstinent, what new insight they might have gained about the recovery process. They can also help them to identify what has helped them facilitate these changes. So what are those specific steps that they are taking that are helping to reinforce the change that they can continue to make? The fifth stage of change is the maintenance stage. Here, this individual has been able to maintain their changes for at least 6 months. So hopefully with addictive disorders, this individual has been abstinent for a full 6 months and would remain in this stage of maintenance all the way up until 5 years. Here, we would see that an individual is very committed to maintaining the new behaviors that they've developed and maintaining their recovery. Professionals would want to be thinking about termination of treatment if it was some kind of intensive therapy, but they would want to encourage that individual to maintain some other forms of treatment, whether it's monthly checkups, continuing to go to self-help groups, looking for aftercare services. They'd want to help them to work on reinforcing those internal rewards. What is it that's helping them stay motivated to maintain these changes? Help identify that. Another really important part of the stages of change with maintenance is informing the individual about the chances of relapse. We know that relapse is a common part of recovery from addictive disorders, and we want to make sure that the client is aware of that as well. We want to help them be prepared for if a relapse does happen, what do I need to do next, and how can I be successful in getting back to maintaining those changes that I had made in the past. The final stage in the stages of change is relapse. Here, the individual might have resumed old behaviors, which may include going back to faulty thinking, to using one time, all the way to more of a full-blown use of their previous substance or behavior of abuse. Nicknames for this stage would be the fall from grace or falling off the wagon stage. In this stage, the best thing that the therapist or professional can do for the client is just be there for them, support them, reduce shame, help them understand that this is a natural part of the process, and then move into identifying what were some of those triggers that might have caused the relapse to happen. Help them evaluate the decisions that they were making prior to the relapse. Help them reassess for their current level of motivation and readiness to start back the change process. Also help them identify any new barriers that might have been identified during this process. Another important step is to help them seek stronger coping strategies. What was it that they weren't doing at that time? Was it that they decided they no longer needed to go to self-help groups? Had they stopped attending aftercare services? Were they hanging out with friends or family members or in environments that weren't supportive of their recovery? Identify what needs to change and what things they can continue to build on. Also, helping remind the individual that they're not starting from scratch, that they've had this period of abstinence to build upon. They've had a slip, but they've learned new things and gained new insight that's going to help them be even more successful in their next attempt. Next, we're going to move into talking about the Continuum of Care model. What is important with the Continuum of Care model is that it helps professionals identify what is the most appropriate level of treatment for the individual that's seeking services. A level of treatment should be assessed on an individual basis, and it really should take into consideration numerous different factors based on that individual. And what we're looking at here is what's going to be the best level of treatment for success that is least invasive of the client's time. So you'll see on the left side of the model, we're starting with our least invasive types of services, which might be attending 12-step groups or other self-help groups, or going into group therapy. We then would move into individual therapy, family therapy options, and getting a little bit more invasive or intensive treatment would be intensive outpatient, where these individuals are spending at least 3 hours a day seeking services inpatient. Then moving into a day treatment option where it's longer but still not 24-hour care, all the way into inpatient residential treatment where these individuals are spending 24 hours a day around the clock or being hospitalized due to serious medical concerns, maybe needing detoxification services. And then you'll also see on the far right, transitional or recovery living. Although this isn't a type of treatment that we may be considering, when the individual is moving from inpatient or being hospitalized, we may consider offering transitional or recovery living, sober living houses for individuals that need a step down after leaving an inpatient service to really be in a supportive environment. So this semester, we will be talking about how we make this decision, what kind of factors come into play, how do we decide what level of care is best for the client, and we'll really get into some of these topic areas when we move into the module that talks about assessment and diagnosing. Finally, the last thing that we will talk about today is NIDA's Principles of Addiction Treatment. There was an assigned reading for you all in your Module 1 that looks at NIDA's Principles of Addiction Treatment that you all should have read. I just very briefly want to touch on a few facts about what exactly NIDA is and why it's really important that you're aware of these 13 principles of addiction treatment. So for those that are not familiar with the National Institute on Drug Abuse, or NIDA, their mission is to lead the nation in bringing the power of science to bear on drug abuse and addiction. In other words, NIDA seeks to utilize research to help us best understand abuse and addiction and to use scientific evidence to support research and to help share the findings of these studies with those who help individuals with an addictive disorder. NIDA supports and conducts research across a broad range of disciplines and really aims to help disseminate this research in a very quick manner to make sure that professionals who work with addictive disorders are providing the best level of care possible for the clients they're working with. The Principles of Addiction Treatment is a resource that serves several purposes, which range from informing treatment practices, providing high-quality research in the future, and helping to inform policies. There are 13 principles that I want you all to be familiar with, and when you look at the principles, you'll get a small description of what research came into play that helped develop that principle of addiction treatment. So for example, if we look at Principle 2, no single treatment is appropriate for everyone. This should really relate well to our continuum of care that we just looked at, which told us that we need to make a decision based on each individual we work with on what level of care is going to be best for that unique individual. So no single treatment is appropriate for everyone, and we need to be thinking about the client that we're working on to decide what services that individual will need. Some of those factors include what substance of abuse or behavior they're using, personal characteristics of that client, the severity of their addictive behavior, past history of treatment, and numerous other factors that we will talk about this semester. Please be sure that you do the reading on the NIDA Principles of Addiction Treatment and familiarize yourself with each of the principles and the research that supports them. Before we close today, I just want to remind students that at the end of Module 1, you'll have your first case application activity due. Please go into your Module 1 content folder and scroll down, and you'll be able to see the instructions for the case application activity 1, what the instructions are, how to complete it, and how to submit it, and what that deadline is. So please don't forget to turn in that first case application activity.